okay if I touch your ears? Thank you. I just want to take a look at the external structures of the ears and see if there are any kinds of irregularities here. Or any differences in the symmetry that could be affecting your hearing bilaterally, as well as the way that you are interpreting sound. Most people are not symmetrical. Actually, nobody's perfectly symmetrical, let's be honest. But sometimes major differences in symmetry can affect the equilibrium of the body. So, just getting an overall feel here before we advance in our exam. Is there any pain or tenderness anywhere? Any areas that are particularly uncomfortable? Okay. Let me know if I come across anything that gives you discomfort. I'm just feeling behind. Not feeling anything out of the ordinary. So, I'm going to take a look now inside of your ear. Oh, come on. There we go. Alright. I need a third arm here. Okay. So since I'm over here, we will start on your right side, okay? Oops. And again. Just like before, just let me know if anything I do causes any kind of discomfort. Okay. In the ear canal here, I don't see any swelling or narrowing. Your ears are pretty clear. There's a little bit of serum in here, but not enough to cause an obstruction. Tympanic membrane appears intact, so that's good. Don't see any signs of redness or fluid or anything like that. Take a look at the other side here as well. So, okay. Just give myself just a little bit closer.
I'm gonna take a quick note, okay? So, alright. I'm going to do a quick test here. I'm going to be turning your head. And in this case, I'm looking to rule out any sign of fluid in the inner ear, which can be difficult to see through the otoscope. So, while I turn your head, I'm going to be watching your eyes, and I'm looking for something called nystagmus, which is when your eyes start sort of flickering as a result of a lack of balance. So, are you ready? Okay. If you start feeling dizzy at all, let me know. We're just starting off with small movements here. Nice and slow. Okay. And then making it just a little bit bigger. Okay. You're doing okay. Let me know if there's a point where you start feeling dizzy or uncomfortable, because we don't want that. And that is also a diagnostic piece of information. Okay. How's that? Are you okay? Okay. Good. Okay. Do another exam before we get too detailed into testing your hearing, okay? And I'm just going to be, actually it's a two-part exam. So first I'm just going to be feeling along your jaw, the area right in front of your ears on your cheeks, and down your throat. And I'm just looking for any signs of lymph node inflammation or involvement. Just feeling your jaw above as well as below the jawline. feeling anything? So that's a good sign. Okay. So the second part of this. You have to push this in to get it to connect, and sometimes it can be a little finicky. Alright, so I'm just going to use this tongue depressor. I'm actually going to switch hands here. So this is just going to, yep, good, open wide. Thank you. And I'm just going to take a look here. The back of your throat, just looking for any sign of drainage, because that can be a sign of there being fluid in the ear. But I don't see any of that present. Okay. Alright. Just put this to the side here. So, physical exam portion is over. Just need to make sure there were no signs of potential ear infection, which could throw off results. So now I'm going to go back in with my otoscope. Only this time I've attached a bulb, which is going to be pushing just little tiny puffs of air, okay? Not enough to feel uncomfortable, hopefully, but if it does cause discomfort, that is also another piece of diagnostic information for us. But I'm just going to be looking through to make sure that your tympanic membranes, your eardrums, are moving in response to the air. So, okay. Again, you're going to feel my otoscope here. Okay, so I'll let you relax for just a couple of seconds. And we're going to, excuse me, and we're going to repeat that, okay? Okay. So, how are you doing? Was that okay? Wasn't too intense? Okay, good. Just want to make sure that there is no evidence of pain, because that can give us information as well. I want to make sure that if there is a diagnosis here, that it is accurate. Okay. Good. Okay. Any dizziness after that? You're doing okay. Okay. Good. Oops. This side for now. Yeah, that's basically, that test makes sure that the eardrum moves in response to the puff of air, because if it's not able to move properly, it can indicate that there might be some fluid in the inner ear or some kind of constriction. And it can be difficult to see sometimes behind the eardrum into the inner ear. Okay, so then we are going to be conducting a hearing test here. There's actually going to be 4 different tests. So the first one we're going to do is just a standard test. I'm going to be placing these headphones over your ears. Okay, just making sure I have these on the right side. And in these headphones, you're going to be hearing a beep playing in each ear. Some of them are going to be at different pitches. So some may be high pitch and some may be low, which actually can be difficult to hear even for healthy ears. Okay. And when you hear a pitch, I just want you to raise the hand on the side that you hear it, okay? Okay. So, just going to be placing these over your ears. It shouldn't be uncomfortable. Okay. So then, just go quickly start the program. Okay, good. Started. Should be finished, yeah? Okay. Take these off of you. So it looks like there were 2 tones that you missed. Both of them were lower pitch, which sort of gives us an inconclusive diagnosis here because sometimes even completely healthy ears aren't able to hear those pitches. Everybody has their hearing range. Okay. So now we're going to do speech testing. I'm going to be whispering some words to you, okay? And I want you to repeat for me what you hear. Alright. I'm gonna start up. We're gonna start off pretty close, okay? So
Technical. Keyboard. Pineapple. Biscuit.
good. Just check because
Scarecrow. Pineapple. Abacaxi.
it means pineapple in Portuguese. What other words do we have here?
Cucumber.
Good. Moving a little bit further away here. So,
Tiger.
good.
Cachorro.
Yeah, that's dog in Portuguese.
Puppies.
Good.
Teclado.
It means keyboard.
Kittens. Flashcards.
Okay, good. So your speech test is negative. You were able to identify all of the words, even the ones that were not in English. So that's good. Okay. Alright. So now we're going to be doing a test called auditory brainstem response. So what that means is I'm going to be placing some electrodes, just 3 of them, on you. And we're going to be testing the inner ear brain pathways and making sure that they're working. So alright. So this first one's gonna go right on your forehead, okay? So right here. Just making sure it is adhering properly. the ever complicated relationship between adhesives and gloves. Alright. Get our leads here. Just making sure our wires are not tangled, because that can throw off our readings. Alright. Just blend in. Okay. Just make sure these wires aren't hanging in your face. So we're going to be placing these headphones back on, just like so. I'm going to be starting a different program, so one sec. Sorry, this one takes just a few moments to load. All this time you're going to be hearing the same series of tones. Don't need you to raise your hand. I'm just going to be keeping an eye on that screen, okay, and seeing whether or not your inner ear pathways are lighting up, alright? Looks like we're starting. be unhooking you. Actually, this one looks like it'll just come off. Sticking to the tissue so you're not sticking to me. There for a sec. Get these off of you. Alright, good. That actually wasn't bad. Sometimes these get stuck to the hair, which can be pretty unpleasant for removing them. Alright. So then we have our final test that we're going to do here, which is called a Weber test, okay? So we're going to be, actually I'll keep my pen. I'm going to be using one of these tuning forks here, okay? And I'm going to be placing these little ball heads in different places on your face. Sounds weird, right? But I want you to tell me if there is a particular side where you hear the ringing more loudly, or if you hear it equally in both ears, okay? Let's see, sometimes, yep, okay. Just a second, I'm going to determine. I like that better, okay. Just wanted to make sure that it wasn't going to be incredibly overwhelming. So, okay, this shouldn't be uncomfortable at all, okay? If it is, let me know. Some people are particularly sensitive to vibrations, but the majority of people don't have any kind of issue with it. So to begin with, I'm placing this on your forehead just like so. Just making little. Okay. Go down right in between your eyes here. Okay. Now to the side. Okay. All right. To our other side here. That was not good. Okay. Place this now on your chin, just like so. So you feel like you heard that a little bit more clearly in the right? Okay. Try on this side here, on your mandible. Okay. The other side as well. Alright. So then it's going to go underneath your chin, just like that. Okay. Alright. And looking here at the hairline, put it right here. Good. And we'll do the other side as well here. Okay. So it looks like you were able to hear more easily with the right, correct? And the less so on the left. Okay. 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 The majority of our exam was normal, however, you did miss a few tones on the hearing test, and you perceived the sound more clearly in your right ear on the Weber test. So what I would like to do is order a head x-ray, so that way we can kind of take a look what may be happening inside. If that is inconclusive, then we will get a CT. Okay. Yeah. The x-rays don't usually show everything, but sometimes they can indicate if there is a source of something like swelling, for example, or any kind of abnormality in the skeletal structure. So we do like to start there, particularly because it's less radiation. So we'd rather give you less than start off with more involved testing. So let me just quickly write it up in order. Right. So I will send this over to radiology. You can just head right on over there when you walk out of here, you just take the stairs down, which you used to come up into this clinic. Okay? And you'll see a sign on the right side. There's a big sign lit up that says radiology. Just push the button so they know that someone is there, and someone will come out and get you, okay? Okay. So then you can go home after that's completed. I will give you a call later, probably this afternoon. Depends on how quickly the radiologist is able to interpret the films and pass that information along to me. It'll definitely be by the end of today, though, okay? Okay. And then once we have that information, we're going to follow up from there. Do you have any questions before I step out? Okay. If you think of any after I leave or after you leave, we can discuss them when I call you later with your results, okay? Okay. We'll talk soon. It was good to see you.